Did you know the #1 cause of death in the United States is heart disease? If you struggle with heart health or know someone that does, then putting strategies in place to reduce your risk of heart disease will not only prevent an early death, but maximize your health. Hi, my name is Dr. Tunis Hunt, and in this short video, I want to share with you 5 simple strategies to reduce your risk of heart disease. According to the CDC, about 630,000 Americans die from heart disease each year. That's 1 in every 4 deaths, making it the #1 cause of death among both men and women. So if having a healthy heart is important to you, then adding a few simple strategies into your daily life is vital. Strategy number 1, eat healthy fats and avoid trans fats. We need fats in our diet, including saturated, polyunsaturated, and unsaturated fats. One fat we don't need, however, is trans fat, which is known to increase your risk of developing heart disease or having a stroke over a lifetime. Trans fat clogs your arteries by raising your bad cholesterol levels and lowering your good cholesterol levels. And by cutting them from your diet, you improve the blood flow throughout your body. So, what are trans fats? They are industry-produced fats often used in packaged baked goods, snack foods, margarines, and fried fast foods to add flavor and texture. So here's a tip. Read the labels on all foods. Trans fat appears on ingredient list as partially hydrogenated oils. So look for 0% trans fat and make it a point to avoid eating these foods. Strategy number 2. Exercise and don't sit for too long at one time. In recent years, studies have shown that sitting for long periods of time is bad for your health no matter how much you exercise. This is bad news for the millions of people who sit at sedentary jobs all day long. When looking at results of several studies that included nearly 800,000 people, researchers found that in those who sat the most, there was an associated 147% increase in cardiovascular events and 90% increase in death caused by these events. In addition, sitting for long periods of time, especially when traveling, increases your risk of deep vein thrombosis or a blood clot. So here's a tip. Move throughout the day. Park farther away from the office. Take few short walks throughout the day and use a standing workstation so that you can move up and down. And remember, you still need to exercise on most days. Strategy number 3, avoid secondhand smoke like the plague. We all know that smoking is bad for us, but studies show that the risk of developing heart disease is about 25 to 30% higher for people who are exposed to secondhand smoke at home or work. According to the American Heart Association, exposure to tobacco smoke contributes to about 34,000 premature heart deaths each year and 7,300 lung cancer deaths. And if you are a non-smoker who happens to also have high blood pressure or high cholesterol, you have an even bigger risk of developing heart disease when exposed to secondhand smoke. This is because the chemicals emitted from cigarette smoke promote the development of plaque buildup in the arteries. So a healthy tip, be firm with smokers that you don't want to be around environmental smoke. And please, please, please keep your children away from secondhand smoke as well. Strategy number 4, rest. Get enough sleep. Sleep is an essential part of keeping your heart healthy. If you don't sleep enough, you may be at a higher risk for cardiovascular disease, no matter your age or other health habits. One study, looking at 3,000 adults over the age of 45, found that those who slept fewer than 6 hours per night were about twice as likely to have stroke or heart attack as those who slept 6 to 8 hours per night. Researchers believe sleeping too little causes underlying health conditions, including high blood pressure and inflammation. So a healthy tip, make sleep a priority. Get 7 to 8 hours of sleep most nights. And if you have sleep apnea, you should be treated, for this condition is linked to heart disease and arrhythmias. Strategy number 5, teeth hygiene. Practice good dental hygiene, especially flossing your teeth. Dental health is a good indication of overall health, including your heart, because those who have periodontal or gum disease often have the same risk factors for heart disease. Studies on this have shown that bacteria in the mouth involved in the development of gum disease can actually move into the bloodstream and cause an elevation in C-reactive protein, which is a marker for inflammation in the blood vessels. And these changes increase your risk of heart disease and stroke. So a healthy tip, floss and brush your teeth daily to ward off gum disease. It's actually more serious than simply fighting cavities. Your heart health depends on it. So for better heart health, remember heart. H, healthy fats. E, exercise. A, avoid smoke and secondhand smoke. R, rest, get proper sleep. And T, teeth hygiene. Simply adding these strategies will not only help you fight off heart disease, but will help you set up for a long, healthy life. Now, if you found value in this video, please be sure to like it and subscribe for future health tips. And as always, thanks for watching and allowing me to be your guide on your hunt for wellness.